This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydroboon Tablet is a hormonal therapy used to manage progesterone deficiency. It addresses various symptoms related to hormonal imbalance effectively. Indications and uses. This medication is indicated for relieving menstrual pain, managing symptoms of endometriosis, and alleviating premenstrual syndrome. It also plays a vital role in supporting female reproductive health, correcting infertility issues, and addressing irregular periods. Additionally, it aids in managing postmenopausal symptoms when combined with estrogens. How it works. Dydroboon Tablet works by supplementing the body with adequate levels of progesterone, improving the uterine lining's thickness, and alleviating symptoms associated with hormonal deficiencies. Directions for use. Take the medication as advised by your healthcare provider. It should be swallowed whole with a glass of water. Do not crush or chew the tablet. Consistency is key, so try to take it at the same time each day. It can be consumed with or without food, and your doctor will determine the appropriate dosage based on your individual health status. Possible side effects. Common side effects can include headaches, nausea, breast pain, and irregular or heavy menstrual periods. If any side effects worsen, it is advisable to consult a healthcare provider. Precautions and warnings. It is important to consult a healthcare professional before using this medication if you have liver problems, a history of depression, or any tumors exacerbated by progesterone. Monitoring is essential for those with pre-existing health conditions, and it is contraindicated for pregnant or breastfeeding women. FAQs. 1. What is Dydroboon Tablet used for? It is used to manage progesterone deficiency and relieve associated symptoms. 2. How should I take it? Swallow the tablet with water, do not chew or crush. 3. What if I miss a dose? Take it as soon as you remember, but skip if it's almost time for the next dose. 4. Are there any side effects? Yes, including headaches and nausea. Consult your doctor if they worsen. Thank you for watching. If you have any questions or suggestions, feel free to comment below. Your feedback is valuable to us.